My name is Seth Little. I'm doing my cranial nerve examination, and it is the 21st of June. So first, we're going to start with cranial nerve 1, olfactor. I'm going to go ahead and have you occlude one of your nostrils and breathe in. Now do the other side. Okay, keep that one plugged, and then close your eyes, and then inhale and tell me what you smell.
Cinnamon.
Okay, other side. Inhale. Tell me what you smell.
Cinnamon.
Was it the same intensity side to side?
Yep.
Awesome. Next, we're going to go on to cranial nerve 2. So I'm going to have you look straight ahead at that dot on the wall, and I'm going to be observing for the red reflex, and make sure my finger's on the diopter. Red reflex, tracing the vessels back into the cup and disc. Good. 3 abnormal findings would be AV nicking, hard exudates, or papilledema. Done that red reflex again. Good. All right, next we're going to do the peripheral field. Let me get the lens back on. So I'm going to have you look at the dot ahead of you, cover one of your eyes, and then tell me when you can see my fingers.
No. 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 No.
Other eye?
No. No. No.
And I'm looking for symmetry within like both eyes. Can you not see that one?
No.
There we go.
No.
I'm just checking the distance
No.
out. Perfect. Next, we're going to do direct and consensual light swing test. Let's take it off. All right, so for direct and consensual, normal findings should be that both eyes constrict. If the left eye didn't constrict whenever I shine the light in it, then it'd be, or excuse me, if both eyes didn't constrict, it'd be a cranial nerve 2 lesion on the left. If I shine the light into the left eye and the right eye didn't constrict, it'd be a cranial nerve 3 lesion on the right side. So we'll do the same thing for this side, checking for direct and consensual. And both of them are constricting, that's good. Next, we'll do swinging light test. And we're looking for symmetry for both eyes to constrict. And if one, say the left eye was not constricting as much, it could be indicative of Marcus gun pupil, and that lesion would be anterior to the optic chiasm. Okay, next we're gonna do we're gonna examine for ptosis and blepharospasm. So go ahead and look at the dot ahead of me. We're looking for droopy eyelids, close your eyes. Looking for blepharospasms, good. Next we're gonna test convergence and accommodation. So look at my finger and then follow it in. And we're checking to see if cranial nerve 6 works, and we're looking for the eyes to AB duct. Good, perfect. Next, we're gonna do accommodation. So you're gonna find that dot on the wall and then find my finger. Find the dot on the wall, find my finger, find the dot on the wall, find my finger. And we're looking for the lens to thicken on this examination. Do the same thing, finger, wall, finger, wall, finger, wall. Good, and his lens is thickening. Okay, next we're gonna do field of gaze for ancient space. By the way, that last one was cranial nerve 3 as well. Now we're gonna check cranial nerves 3, 4, and 6. Go ahead and follow my finger. And for these tests, we're gonna be looking for end stage nystagmus. We're gonna do it 3 times, pause for 3 seconds, pause for 3 seconds. Good. Good. Next, we'll go to X in space. Pause for 3 seconds. Pause for 3 seconds. Good. All right, next we're going to be doing sensory of cranial nerve 5. Can you feel this? Okay, we're going to be checking the 1, 2, and 3. Same intensity all the way through. Same intensity all the way through. Same on both sides. Same intensity all the way through. Same intensity all the way through. Same on both sides. Same intensity all the way through. Same intensity all the way through. Same on both sides. Good. Next we'll do our pinwheel. Can you feel that? Okay. Same intensity all the way through. Same intensity all the way through. Same on both sides. Same intensity all the way through. Same intensity all the way through. Same on both sides. Same intensity all the way through. Same intensity all the way through. Same intensity both sides. Good deal. Next, we're going to be checking motor of cranial nerve 5. So go ahead and bite down for me. Checking the masseters and the temporalis muscles, which are muscles of mastication. Next, I'm going to have you open your mouth and then don't let me shut it. Good. And then next, we're going to have our jaw jerk reflex. So go ahead and open your mouth and then relax it. And we're looking for the jaw to slightly elevate with the jaw jerk reflex. Next, we'll check cranial nerve 7. So go ahead and raise your eyebrows for me. Close your eyes tight and don't let me pull them apart. Good. Puff your cheeks out. Checking the tonicity. Perfect. And next, I'm going to have you smile. Show your teeth. Perfect. Next, we're going to check cranial nerve 8. We're going to start with tandem gait. So go ahead and step off the table, and you're going to take 5 steps, heel to toe, that direction with your eyes open. You're going to be guarding for the patient to make sure they don't fall. Good. Now turn around. Now you're going to do the same test with your eyes closed, heel to toe. Perfect. Go ahead and sit back down. For cranial nerve 8, we can also check for resting nystagmus. Good. Occlude one, or like cup one of your ears. Can you hear this? Tell me when you can't hear it.
No.
Perfect. Other ear. Can you hear this? Tell me when you can't hear it.
No.
Perfect. We'll do Weber's and Renee's. Start with Weber's. Tell me if it lateralizes to one side.
Left.
To the left side. So we'll follow up with Renee's on that side. And we'll put it on the mastoid process. Can you hear that? Okay, tell me when you can't.
No.
Can you hear that?
Yes.
Can you tell me when you can't?
No.
Okay. So if bone conduction was louder than air conduction, it'd be conduction on the left side. If air conduction was longer than bone conduction, it'd be neurosensory on the other side. Next, we're going to check cranial nerves 12. So go ahead and open your mouth. And I'm looking for atrophy and fasciculation. The lesion will be on the same side you see the atrophy and fasciculation, so your tongue out. We're looking for deviation of the tongue to one side. Again, the lesion would be on that side. And then go ahead and you can push your tongue back in. And then put your tongue up against your cheek muscles. And I'm checking for the tonicity of it. Good. And if one side was weaker than the other, the lesion would be on the contralateral side. Next, we'll do palate elevation. So open your mouth and say ah. Okay. For this, we're looking for ablative lesions. So if the palate didn't elevate on one side, that would be the side of the lesion. The uvula would go away. Next, we'll do physiological lesions. So say ah. And we're looking for the palate to fatigue, and it would fatigue on the side that doesn't elevate as much. Next, we'll do the gag reflex. So go ahead and open your mouth. All right, we're gonna do this test bilaterally. There we go. Sorry about that. Next, we will do trapezius and SCM. So go ahead and face away from me on the table. Turn your head to the right. Head to the right. Lift your left shoulder. Extend your head back. Don't let me pull it away. Good. Other side, same thing. Shoulder up. There you go. Don't let me pull it away. Good. Go ahead and lay on your back. You're gonna rotate your head to the right, okay? And you're gonna hold your head and don't let me push down. Good, other side. And then don't let me push down. Good. And that was for cranial nerves 11. And that concludes my video.